You've arrived at the dermatologist's office and you're thinking, what's going to happen next? Hi, I'm Srika Ramachandran. I'm a board-certified dermatologist. We're going to talk about how to navigate psoriasis at your visit with your dermatologist. So going to the doctor can sometimes be a little nerve-wracking. You may have been waiting for your appointment for a number of weeks or sometimes even months. As a dermatologist, I am so happy that you're coming in to address whatever may be going on. So often when you come to the dermatologist and you have a rash, the dermatologist will take a look at the rash and determine whether this looks truly like psoriasis or if there might be something else going on. So for psoriasis, it can look like a few different things, but generally it may be a red, purple plaque with thick scales. It may have some pustules, which can be associated with some forms of psoriasis. Sometimes when we're trying to diagnose psoriasis, it's helpful to look at other body parts. Does this rash exist in places that we commonly see psoriasis? So the elbows, the knees, the backside. Sometimes we can see it in the intertriginous areas such as the groin or under the arms. We may also look at your nails to see if there might be something called nail pitting or some of the other changes that we see in nails in patients who have psoriasis. So you have an exam, but it's also important to make sure that your history is noted. And so your dermatologist will likely ask you, how did you notice this patch? Is it itchy? How does it feel? Do you feel like you're getting more of these lesions? With that history is also a family history. Other things that we come up are, is there a psoriatic arthritis or involvement of the joints? In some percentage of patients with skin psoriasis, there exists psoriatic arthritis, which is inflammation along the joint areas. There are different forms of psoriatic arthritis, and your doctor may ask you about, is there pain? Is there stiffness? Is there swelling? All of these things may be pieces of history that are elicited at a doctor's exam. Everything will differ based on the individual because each rash will look different, but these are some of the things that may come up. Patients often will say to me, oh, I Googled that, I hope that's okay. I am happy when people are looking to find more information and your healthcare professionals are there to help navigate you through what is seeming an endless amount of information that's out there. Don't be afraid to ask questions that you have about your health, about your skin. Sometimes some of my patients really like writing down their questions just because when you're in a new environment, sometimes you like forget some of the things that you were thinking about. I really like to educate my patients wherever I can. I think education is a form of empowerment when it comes to dealing with disease, particularly chronic disease. So know that as you're going in, your doctor is going to want to try to help as much as they can with getting you knowledgeable about the condition that you have. So you're a patient who has been diagnosed with psoriasis. What are some of the things to think about? Some of the things to think about are, what are some appropriate treatments? And that goes hand in hand with figuring out, is there psoriatic arthritis involved? Because the patients who have both psoriasis and psoriatic arthritis may benefit from treatments that are slightly different from a patient who may have just psoriasis. You might also think, well, I have psoriasis. Do I need to treat my skin any differently? Well, it's always important to treat your skin as your best friend. You want to make sure you're moisturizing, you're using sun protection. But in psoriasis, there is actually a phenomenon where skin that is chronically traumatized or chronically touched, rubbed, or irritated can actually develop psoriasis. So you want to treat your psoriatic skin with care. This is not just true with psoriasis, but with a lot of skin diseases. One of the big questions you get is this contagious? Psoriasis is not contagious, and it's important to know that and important for people to be able to do the things they love and enjoy the life they live. Now, with psoriasis, sometimes other things can also be associated. It doesn't necessarily mean that one thing causes the other, but there are other things that can be helpful to look out for. So for instance, there may be an association with increased cardiovascular disease, metabolic syndrome, which can entail different features that may predispose somebody to developing diabetes and other conditions down the road. So all of these things are important to make sure that you're talking to your primary care doctor about any systemic issues that sometimes we find associated with psoriasis as well. So many people can help to bring together these many, sometimes almost seemingly unrelated things, but that are connected by sometimes skin disease, sometimes joint disease. So for a patient with psoriasis, sometimes the primary care is able to really help with limited psoriasis using some of the topical medications and things such as that. For psoriasis that requires more advanced care, a dermatologist can be helpful and talk about more extensive options. A dermatologist may also be able to help identify whether there may be a psoriatic arthritis component involved. Dermatologists may be able to help treat a patient that has psoriasis and psoriatic arthritis. Sometimes with the psoriatic arthritis, if it is more advanced or requires further care, a rheumatologist may be helpful in evaluating the joints as well. Psoriasis can affect many different things, and one of the things we can sometimes see is the association with some mental health issues. And so it's important to make sure that you have somebody on board that can help you navigate those issues as they come up. So with psoriasis, it's really important to make sure you talk to your physician team about where it's affecting you and how it's affecting your life. Right now, we're at a time where there are a lot of potential treatments, and getting on those treatments may be able to enable you to live life to its fullest. Thanks so much for watching. If you want to learn more about what you can do to advocate for yourself as you navigate psoriasis, hit like and subscribe on our Healthline channel.